then what I'm curious to talk about to you now is how do you use the McKenzie? How do you combine that with that type of patient?
Yeah. You know, pain is one of my passions. And, you know, when we started talking, I did have a background with pain, but I know you had a lot of people come on these podcasts, a lot of popular and famous people come on, which is, you know, speaks to your podcast. So I was happy to take the neuro route, but I like to mix in a little bit about my expertise in pain. In the day rehab setting that I work in right now, you know, I'm viewed as one of the pain specialists, and I love to incorporate pain with patients that have neurological conditions. You know, many clinicians are fearful of when they see a neuro patient, you know, or they see spasticity or tone. You're like, oh, I don't know what to do with this, you know. But it's fairly easy when you start seeing it again and again, and you start seeing similar patterns that we do in the ortho world. The school and the training is easily transferable here. So let's take, so my job is to figure out, okay, this person had a stroke. How long ago was their stroke? And let's see their impairments, right? What I see a lot of times is that patients' impairments of the stroke get blamed a lot of the times when it's not their impairment of the stroke, but it's also orthopedic related as well. So one example I'll give you is patient has a stroke. And, you know, after they stroke, they have some spasticity, okay? 3 months go by and we see this patient, okay, in day rehab setting, because they did their aggressive care in inpatient, now they transfer to day rehab. Now this patient is reporting to me, they say, hey, when I had the stroke, I had a little bit of tone or spasticity or spasm in my leg, but now 2-3 months later, it's a lot worse. So whenever you hear that, hey, my symptoms are worse, or my symptoms are better, or my symptoms, that starts to ring a bell in my mind, because their stroke isn't getting worse. They already had the stroke. The stroke is done. Something else is going on that typically answers why they're having it. And typically when you hear of someone with a neurological condition, what I see is they're moving less, they're sitting more. And whenever we see patients in the ortho world that are moving less and sitting more, we jump to the diagnosis of a derangement or an obstruction in a joint. Same thing with neuro patients. When you see someone that doesn't move like they used to, you're going to build some areas, or they're compensating now or moving in different ways than they're used to. Their joints are going to be stiff, and when the stiffness leads to, for ortho patient, may lead to pain or limited motion. And for neuro patient, it can be pain, limited motion, and tone and spasticity. These are like upper motor neuron related injury, and it can continue to act that way. So my job is to, okay, let's move this patient. Let's do repeated motions. Let's do sustained motions like we do in the derangement world, and see if there is change. My baselines might be a little bit different. My baselines may be more functional baseline. I may take a baseline of 5 times sit to stand, or I may take a baseline of their speed and walking. But my test and retest, my assessment, and my setup is very similar. I may have to tweak it a little and make sure that they're safe, you know, depending on their level of injury or how they're injured. But my assessment is going to be the same. And that's what I hope other clinicians, you know, listening to this or as they move on, kind of pick up on that, and not be afraid to move the patient, especially doctors, right? Medical doctors, when they hear spasticity or they hear tone, they're quick to jump to medication, right? They may be quick to jump to baclofen pump, or even sometimes Botox injections in these muscle groups, before really moving the joint, moving the central joint, whether it's their spine or their neck for upper body spasm. So the goal is to move the patient, listen to the patient, where the patient came from, before you jump into the medication.